Hi friends, this is Ila. Welcome to Happy Nursing. Today we will discuss Lydia Hall's theory of care, cure and core. In the 1960s, she put down in her own simple words her thoughts about nursing, and this led to the development of her care, cure, core theory, also known as the 3 C's of Lydia Hall. Lydia Hall's theory defined nursing as the participation in care, core and cure aspects of patient care, where care is the sole function of nurses, whereas the core and cure are shared with other members of the healthcare team. Now the major concepts of Lydia Hall's theory. First of all, individual. Hall said the source of energy and motivation for healing lies in the individual care recipient, means the client himself, and not in the healthcare provider. For example, a patient is very depressed. The nurses and doctors are doing their job as per the patient's need, but if she herself doesn't accept the treatment positively, she will never be fully cured. Friends, if you have experience in the medical field, then you will see environment and mental stability has a great role in curing the patient. Maybe we are giving all the medications needed and the patient is relieved of his bodily symptoms, but if she always holds a negative attitude towards herself and remains depressed, then she is also not going to follow the medical advice properly. She may think all of these are in vain due to her state of mind. So what's the use of taking medicines? What's the use of treatment regimen? And she may stop the follow-up or consultations. She may be sleepless in nights, which can again affect her health. She may stop taking food properly. She may not rest and again fall sick. So until and unless the patient has a positive outlook, until and unless she has the proper motivation, she can never have the energy to cure and heal herself completely. So that's why healing depends on the patient and not on the healthcare providers. Health can be said as a state of self-awareness with a conscious selection of optimal behaviors for that individual. We have already discussed that only the client has the real power to heal himself. So when is that possible? When he recognizes his harmful behaviors and rectify them. That's why Hall stresses in helping the person explore the meaning of his or her behavior to identify and overcome problems through developing self-identity and maturity. The concept of society or environment is concerned with the individual. According to Hall, the hospital environment during treatment of acute illness creates a difficult psychological experience for the ill individual. For example, when a patient is admitted in a hospital, he is always surrounded by the healthcare workers, doctors, nurses, housekeeping staffs. Everybody is talking about the treatment, what medicines he need to take, what investigations he need to go through. Nobody is concerned about the thoughts going on in the patient's mind. He is looking at the IV fluids, injections, hospital foods, etc. and getting only a limited time with his relatives. These create a stressful situation for him. So she developed the idea of Loeb Center, which focuses on providing an environment that is helpful for self-development. In such a setting, the focus of the nurse's action is the individual. Next is nursing, which is identified as participating in the care, core and cure aspects of patient care, which we will discuss in detail in the sub-concepts. Now coming to the sub-concepts. First one is the care circle. This circle solely represents the role of nurses and is focused on performing the task of nurturing patients. This nurturing involves the concept of care and comfort of the client and provides for teaching learning activities also. For example, a professional nurse's primary role is to provide basic care for a client, such as eating, bathing, elimination and dressing. When providing this care, the nurse's goal is the comfort of the patient. Besides that, nurse's role also includes educating patients and helping them to meet any needs which they are not able to meet alone. For example, helping them to perform their activities of daily living, teaching them lifestyle modification behaviors, etc. This provides the nurse and patient with an opportunity for closeness. As closeness develops, the patient can share and explore his feelings with the nurse. Next is the core circle. According to Hall's theory, core is the patient receiving nursing care, means the recipient of care. The patient has set goals set by him or herself rather than by any other person, and he behaves according to that. These goals generally depend on the patient's social, emotional, spiritual and intellectual needs concerning his family, institution, community and the world. For example, a patient may be the only earning member of his family. Suddenly he falls sick. So he may have a goal in his mind that he has to recover and take care of his family. Someone may hold an authoritarian position in a school or college. He may think as soon as he recovers, he has to go and join work. Otherwise, everything there will be a mess. So everyone has their own thoughts regarding their disease process and its effects. Now the concept of core helps them to share their thoughts with the nurses, and through such expression the patient can gain self-identity and further develop maturity. For example, the one who is the sole earner of his family, maybe he has a very bad habit of skipping his meals. When he falls sick, he worries about his family, realizes that he has to recover fast, otherwise his family will be helpless without him. Thus, he gains a self-identity. Next, what happens when he shares his thoughts with the nurse? She helps him to understand that he must quit skipping his meals and adopt a healthy lifestyle. Thus, he gains a maturity about himself. Next is the cure circle, which involves the administration of medications and treatments. The nurse shares the cure circle with other health professionals, such as physicians and other nurses. For example, she discusses the treatment process of a client with the doctors and other members of the healthcare team. And these actions are aimed at treating the patient and relieving him of whatever illness he or she is suffering from. I hope you have got a clear idea about the three circles. Now this is the figure of those three interlocking circles, where a nurse functions in all the three circles but in varying degrees. Her role keeps on changing. For example, in the care phase, the nurse gives hands-on bodily care to the patient regarding daily living activities such as cleaning and bathing. In the core phase, the nurse addresses the patient's social and emotional needs and helps through the reflective technique. Why are we calling it a reflective technique? Because here the nurse acts as a mirror for the patient. She helps him to visualize his own feelings about his disease process and its effects, and also shows him the lifestyle patterns which have actually caused the disease. This acts as a motivation. The client gains an awareness about himself and his behavior, which guides him in making conscious decisions based on understood and accepted feelings. And lastly, in the cure phase, the nurse applies her medical knowledge and practices for the treatment of patient. I hope you have got the idea of Lydia Hall's theory. If you like this video, like and share it and subscribe my channel. Click on the bell icon to get the notification of my next video. Thank you for watching.